The platform for today's discussion with therapeutic perspective of diabetes. We have already came across the diagnostic part, the monitoring part, and after that, definitely it's left that the therapy of diabetes mellitus. And I have given the responsibility with DPP4 inhibitor therapy. And among the DPP4 inhibitor therapy, obviously vildagliptin is the one of the important choice whenever we consider a DPP4 inhibitor therapy to our patient with diabetes mellitus. So this is the roadmap of my presentations. What are the roadblocks? Definitely today's topic is, can vildagliptin addresses the roadblock of type 2 diabetes management? So definitely what are the roadblocks? We'll try to find out, and we'll try to find out the rationality of gliptin therapy. So for the current consideration of pathophysiology of diabetes mellitus is concerned, that is the ominous octet. The incretin mimetics are more effective in Asian Indian patient compared to Western counterpart, and we'll try to find out role of vildagliptin in addressing the different roadblocks in management of diabetes. We'll try to find out the supporting evidences. What are the supporting evidences are available in favor of vildagliptin in different spectrum of diabetes patients, starting from newly diagnosed younger patient to elderly patients with comorbidities, hepatic function, renal function particularly. And we'll highlight on once daily vildagliptin, which are currently available in market for the patient adherence, because adherence and compliance is one of the important issue for vildagliptin, because traditional dose is twice daily dose, and ultimately we'll sum up. So what are the roadblocks in diabetes management, particularly OAD concerns are there? So in management of type 2 diabetes, definitely OAD comes first. And apart from metformin, whenever we try to choose the second line of therapy, the different perspective actually come. This perspective are definitely patient's perspective. What is the patient comorbidities, patient's affordability, weight, patient's weight gain and hypoglycemia concern. But whenever we choose any therapy for diabetes, particularly, we need to think of the safety of this drug, safety in respect to cardiovascular safety, hepatic safety, renal safety, and as well as safety in respect to your hypoglycemia concern and weight gain concern. So this is, and apart from this, we need to think of the efficacy, whether the drug will be efficacious or not. So far, it will be able to achieve the target glycemic parameters, that is the HbA1c, will be able to address or not. What is the durability of the therapy? Are the therapy will be durable enough so that the secondary failure rate can be lessened? We all know that fewer drugs, what are the traditionally available for a long time, are known for high secondary failure rate. So the drug has to be durable enough. And compliance is the one of the important concern. Multiple doses actually hampers this compliance, as well as the few important side effects related to the drug, particularly genital tract infection, hypoglycemia. This actually impairs the compliance of the drug. And affordability is one of the important issue, whether drug has to be pocket friendly or not, so that it can be continued for a long-term therapy. So these are basically roadblocks, and we'll try to find out whether vildagliptin will be able to address the roadblock in a long-term management of diabetes. So this is ominous octet. This is the current consensus of pathophysiology of diabetes. These 8 ominous things are actually leads to hyperglycemia. And if we think of incretinomimetics, starting from GLP-1 analog to DPP4 inhibitor, these are basically addresses the various aspect of this ominous octet. You see the tick mark actually, the secretory defect of pancreas in the form of insulin secretory defect, the hyperglucagonemia, the incretin defect, increased lipolysis, and along with, to some extent, the neurotransmitter dysfunction of brain, that is the satiety center abnormality, can be addressed whenever a patient being treated with incretin as like DPP-4 inhibitor like vildagliptin. So, if the patient is being diagnosed to have diabetes, incretin defect is one of the key concern. And that incretin defects mean that the insulin being secreting less, whether the patient is having unchecked glucagon secretion, and that leads to hyperglycemia. But whenever this patient being treated with DPP-4 inhibitor, it actually restores the incretin defect in the form of the prolonging the action of insulin that leads to increased insulin secretion and obviously suppressing the glucagon. So improved glycemic control is the ultimate key thing. So it's a rational therapy. DPP-4 inhibitor therapy is a rational therapy, and its therapy is actually targeting the key pathophysiological defect of diabetes mellitus. So our incretin are more suitable for Indian type 2 diabetes patient. The famous article by Dr. Misra et al., it has shown that non-obese type 2 diabetes patient, Asian Indians, they have shown the higher DPP-4 level, and that DPP-4 level actually correlates with different anthropometric as well as metabolic parameters of the body, as like waist hip ratio, intra-abdominal adipose tissue, liver span, high fasting insulin, low LDL, low density lipoprotein, and triceps skin fold thickness. So that indicates that even in a non-obese patient, they are having high DPP-4 activity in compared to non-obese, non-diabetic counterpart. And this meta-analysis by Dr. A.K. Singh et al., they have shown that the different studies, including the DPP-4 inhibitor, the Asian patients do better. So for the HbA1c control is concerned compared to non-Asian counterparts. We have quoted the two trials by Park et al. And Kim Wai et al. It has shown that the DPP-4 inhibitor do good compared to in Asian patient compared to non-Asian counterparts. And each patients are different, as sir has been just pointed out, the patient-centric approach. Whenever we are treating a patient, we need to think of that, what is the patient concern, what is the key factors related to that particular patient. So for the age, BMI, current glycemic status, hypoglycemia concern, the affordability of the patient, duration of diabetes, and established cardiovascular disease. So considering all these things, we need to formulate the proper therapy for proper glycemic management. Let's see the evidences of vildagliptin across the different spectrum of diabetes patient, starting from newly diagnosed patient to patient with established diabetes along with the comorbidity, along with long-standing diabetes patient with different organ damages. So initial study is a study with the patient with newly diagnosed diabetes patient with a early combination therapy with metformin and vildagliptin. Optima control study. Optima control study is the studies for patient with sitagliptin head-to-head with vildagliptin on insulin, and to see the glycemic variability. Age study, the patient with NFLD along with patient with cardiovascular risk, particularly many studies are there to show the cardiovascular safety, though these studies are not so-called the cardiovascular outcome trial. The virtue study is the patient is with Ramadan. It has been shown that the vildagliptin do better in patient with even in Ramadan with a less hypoglycemia. Even in elderly patient with renal impairment, vildagliptin has shown its efficacy with a less risk of hypoglycemia. Though DPP-4 inhibitor have a tagline along with patient having heart failure to use with caution, but study with patient the vildagliptin with heart failure patients are there. It has been shown that no increased incidences of heart failures are there. Though there are not any head-to-head trial in between the different DPP-4 inhibitor, but it has been shown that in this tiny study, the vildagliptin did better to some extent compared to lina and sitagliptin. So for the HbA1c reduction is concerned, and patient attaining their target HbA1c along with requirement of insulin is less in Vildagliptin group compared to metformin group. Initial study is a recently diagnosed diabetes mellitus patient. Age study is the real world study as a add-on therapy to metformin. You see the number of patients in these real world studies. This is the add-on therapy to metformin compared to other oral anti-diabetic drug, and it has been shown that Vildagliptin did better as a add-on therapy to metformin compared to other comparative anti-diabetic drug in this real world study. Verified trial, as you all know, that verified trial is a well-known trial, is a landmark trial, and this has changed the landscape of management of diabetes with a starting with early combination therapy, as the verified trial shows that early combination therapy actually reduces the secondary failure rate to the tune of 49%. So glycemic variability is one of the important concern for the management of diabetes mellitus nowadays. And DPP4 inhibitor as a whole has a do good for glycemic variability because it not only increases the insulin secretion in a glucose dependent manner, but also it reduces the glucagon secretion. You see that this is the glycemic variability by its sense, and it causes the improvement of the insulin secretion and reduction of the glucagon secretion in the phase of hyperglycemia, but it stimulates the insulin secretion in the phase of hypoglycemia. So this is the head-to-head trial versus glimepiride for glycemic variability, and those patients being treated with Vildagliptin has a less glycemic variability compared to glimepiride, and patient on Vildagliptin compared to sitagliptin do better so far the time in range is concerned, because time in range is nowadays is the most accepted parameter for glycemic variability. So this is also a time in range study. So this is the Vildagliptin study that has been shown that those patients with Vildagliptin along with insulin, they do better 76% in time in range compared to insulin only group. So patient treating with insulin, if you add Vildagliptin like DPP4 inhibitor, the glycemic variability can be lessened, and also incidences of hypoglycemia can be lessened because of this dynamic way of action of Vildagliptin on glucagon particularly. Safety parameters has been, you see that organ safety parameters, you like the QT prolongation part. The Vildagliptin has been studied in a therapeutic dose of 100 milligram and 400 milligram, that is supratherapeutic dose, in comparison to moxifloxacin, which is a well-known drug for QT prolongation. And you see that this is the solid rhomboid is the Vildagliptin 100 milligram. It has been shown that less QT prolongation compared to the moxifloxacin. This is the moxifloxacin group. So we can accept this therapeutic dose of Vildagliptin so far the QT prolongation is concerned. There is no risk of much QT prolongation. So Vildagliptin, this dynamic action of glucagon in phase of hypoglycemia, it has been shown that it stimulates the glucagon secretion. It leads to reduction of the hypoglycemia in hypoglycemic part, whereas in hyperglycemia, it actually suppresses the glucagon. Vector study is basically study with Ramadan patient, and it has been shown that those patients on Ramadan actually less incidences of hypoglycemia and weight gain. And virtue study is a more vector study, the study population is less, but in virtue study is 1300 Muslim patients. Then this is the multi-centric study. You see that those patients on Vildagliptin, they had a less incidences of hypoglycemia compared to sulfonylurea. Basically, the sulfonylurea used in this study is glyclazide. So less incidences of hypoglycemia as well as less weight gain in patient being treated with Vildagliptin compared to sulfonylurea, that is the glyclazide 80 milligram. Renoprotective action can be postulated by this mechanism, that because patient with diabetic kidney disease, it has been shown that higher expression of the DPP4 and TGA beta activation as well as microRNA suppression. So by inhibiting DP4, we can expect that some amount of renal protection by using DP4 inhibitors. And it has been used in a different spectrum of patient with renal impairment, mild renal impairment, moderate, severe, even in ESRD patient. You see that when patient eGFR comes to around less than 40 or to some extent where it has been shown less than 30, it better to shift to once daily dose of vildagliptin, and it's do good also even in a hemodialyzed patient. Hepatic safety, though vildagliptin, some anecdotal reports are there, it leads to the hepatic impairment, the liver enzyme defect as like that. But various studies, almost 107 studies are being conducted, and it has been shown that it has not been lead to that kind of hepatic enzyme elevation or liver injury. Rather, in a patient with NFLD, so this drug actually do good, and it has been shown that reduction of the hepatic triglyceride content, those patients being treated with vildagliptin compared to placebo. So 100 milligram oral daily, once daily dose, even immediate release tablet also do not lead to significant hepatic injury as it has been thought of earlier. So now problem is that adherence to the therapy of twice daily dose, because in spite of prescription of twice daily dose of vildagliptin, most of the patient takes once daily. So to improve the adherence, once daily dose vildagliptin has been being used, and proper bioequivalence studies has been conducted using this 100 daily, once daily versus twice daily dose. And this bioequivalence data actually proved that it is equally effective, so for the efficacy is concerned, as like twice daily vildagliptin. So this is NJPP trial that actually proves that twice daily vildagliptin actually do almost similar efficacy over the HbA1c, fasting PP, as well as wealth neutrality and the safety parameters are like liver enzyme. As like twice daily vildagliptin, there is no difference in between that. So to summarize that present day diabetes is a management is a therapeutic challenge because of many drugs are being available, but obviously there are some pros cons between these drugs. Incretin mimetics are the pathophysiological oriented drugs addressing the mania defect in ominous octet. It's a selective, vildagliptin is a potent, selective and reversible DP4 inhibitor. It's an effective option in management of glycemic variability. It is a good weight neutrality and cardio-renal safety profile being established, though so-called the CVOT trial is not being conducted. The effective across the spectrum of diabetes mellitus, being as elderly or young. So it may address the major roadblocks in type 2 diabetes management. With this, I'd like to thank you for your patient hearing.